Total knee replacements are very common within CAO. A lot of our doctors perform this procedure, and it's something that we see quite frequently in physical therapy. We've developed this program where we have what we call prehab and then rehabilitation after the surgery as well. So typically what will happen is a patient will come in before the surgery, and that's our opportunity to find deficits that we can help fix before they go into surgery. So the stronger you are beforehand, the more range of motion you have beforehand, the better your outcomes are on the back end. So typically you'll come in for 1 to 2 visits. We'll look at things such as gait deviations, range of motion, strength deficits, and a large part of it too is education. A lot of times people go into this procedure because the doctor says, hey, look, you really need this surgery, and they're spot on, that's correct. But you don't necessarily know all of the details that go into it. So part of physical therapy is also education. A lot of times we talk about the anatomy, the 2 bones that make up the knee joint primarily. You got your femur and your tibia. They make up the major part of the knee joint, and how the cartilage is worn down. After that, we go into details about the surgery, how long it usually takes, and then afterwards, what to expect. Typically afterwards, depending on comorbidities and other things that you may have going on, you are typically discharged from the hospital that same day and you're back home. Sometimes you may be requested to stay a night or 2 just to monitor things, but most times you're back home. Again, depending on how advanced you are going into the surgery, you may have home therapy come out and help you at home for 2-3 weeks, or you might go right into outpatient therapy, and that's where we come into play at CAO. Once you come in, we kind of hit the ground running. It can be a pretty aggressive form of therapy, but it's all detailed to what your impairments are and gradually built upon. So primarily when you come in, we're working on range of motion off the bat, getting swelling down, pain management, and that's kind of the first initial phase. Once we start to develop all of that, then we start working on gait mechanics and strength. Typically, I'd say on average, somebody's in outpatient physical therapy post-operatively for about 8 to 12 weeks. Some people respond really well, and you're on the shorter end of that, and some people don't respond quite as well, and you might be on the longer end of that. Big picture though, we're getting you right where you need to be. Part of physical therapy, when you come in for your initial evaluation, you establish goals, and some of those goals are based off of hobbies, some of them are based off of occupation, and some of them are just based off of daily functional activities. So after your 8 to 12 weeks of physical therapy, you can expect that you and your therapist have developed these goals, and that's what you've been working towards. Now, whether that's you just want to be able to go on a walk for a mile every single day with your dog, or if that means you want to get back to playing pickleball. After you establish those goals with your therapist, you can expect to get back to your goals and prior level of function with no deficits.